very good afternoon to you, Sandy. Thank you for your time. Perhaps let's start there. What is South Africa's understanding of food security?
So South Africa's understanding of food security is that we measure food security in accordance to income available per household. So that is how we measure our food security in the country.
Now, how does Operation Hunger hope to empower, because this is obviously the core of the issue here, empower the South African child to ensure that going to bed hungry is a thing of the past?
So what we have is we've got programs available to basically integrate actually communities. So we're not only just looking at children, but we're looking at the full communities as a whole, but of course prioritizing the children. So what we do is we basically provide interventions that actually assist communities from being completely, in nutrition inequity to all the way to being sustainable. And doing that is we have a myriad of programs that enable people from coming into our relief programs all the way to integrating them to community sustainable projects, so that they obviously can be able to be self-sustainable and create their own income and have enough food to provide for their families without actually having. So it's almost like an assistant to the household income.
Sandy, a lot of South Africans have always said that COVID-19 has essentially exposed a lot of the inefficiencies and flaws of the government and what they have not been able to do for the man on the ground. How severe is the situation more now that we are under the spotlight because of this pandemic?
It has become more severe because you will remember that before the COVID-19 period, the global report had indicated that South Africa, this country, will only reach about 2 out of 8 of the global nutrition targets, and that means basically we're sitting on 49% of child stunting. So that's a huge problem altogether. And I think basically what has happened during the COVID-19 is only just highlighted the issues that the dysfunctions in our health systems, in our health coverage, as well as a link to our food systems as a whole.
Government has obviously always looked to alleviate hunger, as it is their job as the government, and to alleviate poverty as well. But what more can they do, given that we are going through so much as a country, economically at least?
I think basically there has been quite a great, efforts in terms of getting people to, over the COVID-19, of getting people to getting into immediate relief interventions. But I think, at this time we should be looking at how do we integrate those relief programs into basically sustainable, and integrating people into the sustainable, food systems at the moment. Because at the moment, as we're looking at integrating the economy and just like reactivating that, but we shouldn't look back at actually getting people back into also being in sustainability. And I think basically what has happened also, because of course of all the factors that have that have impacted as a cause of COVID-19, as a result of COVID-19, is that we've seen obviously a lot of unemployment of people that used to be able to provide food for themselves, that were on informal sectors as well, like such as your taxi drivers, your taxify drivers, all of those people that were on the informal sector that haven't been able to operate substantially because of the COVID-19, and that has provided a huge burden basically onto the economy, and obviously a double burden onto the health systems, and like your non-communal diseases that result from poor diets are what we're sitting with at the moment. Yes.
Just before I let you go, Sandy, quickly, what is the importance of NGOs in, I suppose, aiding government and aiding every other organization that is trying to alleviate poverty and hunger?
It's really relevant and very important, and I think basically not only just NGOs, but I think all sectors across, because if we're looking at nutrition and we're looking at ourselves becoming self-sustainable and being food secure as a country, we need to start looking at the relative integration from food production all the way to consumption, and basically the food the relationship between that and integrate it into our health systems. Because, for example, if there was a lot of budget that was focusing on prevention methods rather than, like the treating of the causes, we would actually be sitting at a much more better position at the moment. And that is basically what we're suggesting, is that, we look at a much more nutrition equity, approach, instead of just basically looking at only the results or the impact of not having.
Sandy, thank you so much for your time this afternoon. That's Sandy Buluga, who is the Interim Chief Executive Officer of Operation Hunger.